Advanced Psychology. Atypical Behaviour. Definition and classification of atypical behavior. Sick role and expert role. Parsons, 1951, was a sociologist who was interested in the way roles are assigned to people. He thought that illness involved accepting a sick role. This is a set of expectations and corresponding sanctions governing the behavior of the individual. For example, if you have a bad cold during winter, you should stay in bed, the expectation. Going out without a coat would be frowned upon, the sanction. Parsons believed there were 4 aspects to the sick role. 1. The individual is free from normal social role responsibilities. For example, you can stay away from college for a few days. 2. The individual is not expected to recover by an act of will. The patient must be cared for. In other words, you are not expected to pull yourself together. 3. The state of being ill is undesirable and the sick role therefore includes an obligation to get well. For example, you must recover in time for your exam. 4. Recovery requires seeking out the assistance of technically competent help. For example, your mum goes to the chemist for a cold cure. The idea of the sick role has been applied to people suffering from mental ill health. In the medical model, the responsibility for recovery is taken away from the patient. A technically competent expert, the psychiatrist, will prescribe the appropriate treatment. Martin, 1999, described a way of helping mental health patients accept the sick role by showing patients pictures of their own brain scans. This process allows the patients to see that their experiences are biological and beyond their control. There is some evidence, however, that other people do not attribute the sick role to those suffering from mental illness. Study 1. The aim. Bromley, 2002, wanted to investigate the acceptance of the sick role by visitors of mental health patients, compared to patients with physical conditions. Method. She compared cards and gifts received by 40 psychiatric patients aged 18 to 65, with those of a matched group of patients who had physical conditions such as asthma, and liver and gastrointestinal disorders. Result. The psychiatric patients received almost half as many cards as the medical patients even though they stayed in hospital on average 5 times longer. The psychiatric patients received just 1 bunch of flowers throughout the study. On the medical wards, Bromley reported, "You can't move for flowers." Conclusion. Bromley believed that the cards and flowers indicated a validation of the sick role for medical patients. Mental health patients are less likely to be perceived in this way. As one patient commented, "There's the feeling that mental illness can't be cured, so it's not appropriate to send a get well card." Evaluative comment. There are specific difficulties in applying the sick role to mental health problems. In some disorders, such as anorexia, the individual may refuse to accept that they are ill. Treatment of mental health patients is therefore sometimes given without their consent. This type of intervention is not considered in Parsons' model of the sick role. Critics of the medical model have argued that patients should not be encouraged to avoid responsibility. By adopting a sick role, the individual becomes passively dependent on others. Some researchers, for example, Caution, 1976, have argued that failure to take control can interfere directly with the recovery process and result in chronic, long-lasting conditions. Psychological treatments, such as cognitive or behavioral therapy, all require active participation by the client for recovery to begin. The sick role also implies a restoration of health, after treatment has been given. Ralph and Kidder, 2000, argued that complete recovery from mental illness is sometimes unobtainable. It is more useful to consider recovering as an ongoing process. They give a useful example, taken from the experience of bereavement, to illustrate their point. Parents whose child has died might never really recover from this, in the sense that nothing feels the same since the loss occurred. However, these parents often experience a process in which the loss is integrated into their lives, so that they are able to continue. Ralph and Kidder called this recovering, and they liken the process to the way many people with mental health problems live with and adjust to their problems. The sick role automatically also creates an expert role. The patient should consult a technically competent person for the appropriate treatment. In the case of the medical model of mental illness, this could be a GP, a psychiatrist, or a psychiatric nurse. With a more psychogenic approach, the expert would be a clinical psychologist or a counselor. Study 2. The aim. Temelin, 1970, wanted to investigate the impact of a respected authority figure on psychiatric diagnosis. Method. Participants listened to a taped interview of a person describing their own life. Psychiatrists, clinical psychologists and psychology students heard the person talk about his happy marriage, good relationships with others and his enjoyment of work. A respected expert in psychiatry then told the participants, either that the man was psychologically healthy or that although he seemed neurotic, he was in fact psychotic. Participants were then asked to judge the person's mental health. Result: the participants were affected by the opinion of the expert. Those who were told he was healthy gave a normal diagnosis. Those who were told he was psychotic agreed with this diagnosis. Conclusion: someone with authority and expertise can have a strong influence on the way people are perceived. Evaluative comment. Again, with Temelin's study, the participants were making a judgment on a hypothetical case. They may have responded differently if the person was actually in their consulting room. It is difficult to gather information about the real-life roles and interactions between psychiatrists and patients because of ethical considerations. There are a lot of different experts with differing opinions on the causes and appropriate treatments for mental health problems. This might lead critics to question whether any experts actually exist. Steinberg, 1989, proposed a different way of viewing the roles of patient and practitioner. He believed that the clinicians are experts in their own specialty, the patients are experts on themselves, the clinicians have a responsibility to teach and to learn. Psychiatrists can help the patient to understand the disorder and how the treatment will work. However, doctors and psychiatrists should also be prepared to learn more about their patients. For example, how do they understand the disorder and what do they need? Demand characteristics of the consultation process. The meeting between a mental health practitioner and their patient is called the consultation process. It is an interpersonal exchange of information that could be subject to demand characteristics. This is where participants in an interaction try to work out what is expected of them and change their behavior as a result. Demand characteristics often prompt an individual to behave in a way that is predictable, given the circumstances. Psychiatrists are expected to recognize symptoms and make a diagnosis during the consultation process. Patients are expected to display symptoms of mental ill health. Their own doctor often refers patients for psychiatric assessment. The doctor will forward relevant information to the psychiatrist before the consultation occurs. This means that the psychiatrist will have some prior knowledge, and possibly expectations, about the patient before they actually meet. Rosenhan, 1973, gave a powerful demonstration of the effect of expectation and labeling in his first study. In a follow-up study, he told staff in a psychiatric hospital about his previous findings and asked if they would like to participate in some more research. Study 3. The aim. Rosenhan, 1973, wanted to show that expectation can alter the type of diagnostic decision made. Method. He advised members of a teaching hospital that over a 3-month period, some pseudo-patients were going to try to gain a psychiatric diagnosis and admission to the wards. They should therefore expect to see normal people during their consultations and should make a note of any patients they believed were participants in the study. No pseudo-patients were sent. Result. During the experimental period, 193 genuine patients were admitted. 41 were confidently identified as pseudo-patients by at least one member of staff. Conclusion. Diagnosis of mental illness can be affected by demand characteristics. If practitioners are told to look for normal behavior, they are more likely to see normal behavior. Evaluative comment. Although Rosenhan did gain consent in this second study, there are still ethical problems because deception was used. Also, as the study took place in one hospital, it isn't possible to generalize from the results. Patients will also have some prior expectations about what will happen during consultation and how they should behave. For example, Davison and Neal, 2001, argued that Freud's patients were aware of his theory about the psychosexual stages and the importance of childhood in the development of personality. This caused him to focus on childhood events and sexuality during psychoanalysis. In effect, they told Freud what he wanted to hear. Other important and more current events were possibly overlooked, as both the patient and the practitioner did not feel they were relevant. The same demand characteristics could operate in the medical model, with patients overemphasizing physical factors. The class, race, gender, culture and age of either the patient or the practitioner will also have an impact on the consultation process. For example, Levine and Padilla, 1980, found that Hispanic patients disclose less about their problems to non-Hispanic white clinicians than do white patients. Evaluative comment. The demand characteristics of the consultation process are apparent in physical illnesses as well as in mental health problems. Both doctors and patients are human beings. This does not mean that people should not consult a doctor when they are experiencing physical or mental health problems. The impact of interpersonal issues such as demand characteristics and stereotyping should be considered when evaluating the medical model. However, it is important not to lose sight of the valuable role psychiatrists and doctors play in alleviating the symptoms of mental disorder.